Hello everyone, it's Dr. Dave. Hopefully you're all doing well, enjoying your week. You made it to the middle end of March. Congratulations. Coming at you on behalf of the Toronto Neck and Back Pain Clinic with your daily health update for March 31st, 2021. I'm going to share with you 6 areas of health and wellness. We're going to touch on a couple specifically, but somewhere around this video you can magically read through all 6 areas if you like. Plus, if you'd want a hard copy sent to you, we could get that to you. Just DM us on social, give us a call here at the clinic, or send us an email and we'll be sure to get that your way. Not going to treat, diagnose, prevent, or cure any illness or disease with our time together today. However, promise to educate you, maybe empower you, and even entertain you a little bit with the latest and greatest from the research and literature that exists out there from the health and wellness journals and reports. That way, when you plug in daily and you get some of that information, could help influence your own thoughts, decisions, and actions when it comes to your health and wellness to support those great experiences you're trying to live and create every day. And it's a good thing to try and do for sure. The PLOS ONE journal, February 2021, looked at the connection between low vitamin E levels and insulin resistance. They looked at a study of cardiovascular risk in adolescents, and 1 in 4 of those teens had some degree of insulin resistance, which can set the stage for type 2 diabetes. So the common risk factors for insulin resistance are obesity, large waist circumference, high triglycerides, and physical inactivity. But they also found that low vitamin E levels would link to one's risk for that insulin resistance. So good to know, all coming from your diet. And according to that diet, a need of ours, the British Medical Journal case reports, February 2021, looked at how the diet can be the key to resolving leg ulcers. So if you or someone you know is prone to or suffers from leg ulcers, you can find out what foods are good for and which foods are not so good for someone who has those leg ulcers. The American Academy of Neurology, April 2021, looked at mental illness linked to early onset of Alzheimer's. So having some challenges with our cognitive health early on in life could set the stage for an increased likelihood of Alzheimer's later in life. That's the gist of it from the American Academy of Neurology. You can check that out. And the journal Medicine, March 2021, looked at the correlation between sleep and diet and how that, if those are done well, could stave off metabolic syndrome. And of course, metabolic syndrome increases the risk of heart disease, stroke, and type 2 diabetes. So this study shows how sleep and diet may help affect those. Good to read through that if you like, and you can look it up. Otherwise, we're going to look at what the American Academy of Neurology had to say about exercise and migraines. They had questionnaires completed by over 4,600 migraine sufferers, and it revealed an association between regular exercise and up to a 50% reduction in headache frequency. The researchers note that exercise can reduce stress, depression, and poor sleep, all of which can be triggers for migraines. So if you already exercise, perhaps it's and your migraines are still occurring at some frequency and intensity, then it may be worthwhile trying and experimenting with different forms of exercise, because they may affect your body in a different way and have a different effect on those migraines. And of course, if you haven't or aren't an exerciser and you do get migraines, you may want to add that to your routine. You may want to work with a healthcare provider to look at those variables. Maybe someone like a chiropractor, perhaps an exercise physiologist might be someone good to see for that. But any qualified healthcare provider who has an interest or background and correlating those two things, the fitness and exercise along with the migraines, could be good for you, worthwhile looking into. And finally, physical therapy and sport, March 2021, looked at mobilization and how effective it is for ankle sprains, inversion ankle sprains, people with inversion ankle sprains, where the ankle twists outward and your foot comes inward or upward on the inside, were treated with mobilization therapy, and they experienced improvements in pain, mobility, and function that persisted for several months following the conclusion of the treatment. Of course, that kind of mobilization and or manipulation of the joints performed by different paramedical providers, and you can look those people up, different chiropractors, osteopaths, physical therapists, and the like can help with that if you've sprained your ankle, especially if it's an ankle sprain that's improved, but for some reason it didn't fully resolve or doesn't feel 100%. You may want to get that looked at to recover that function as much as possible. All right, so that's your daily health update for today. We'll look forward to catching up with you Thursday. Last video daily health update of the week, but the first one for April tomorrow. So we'll look forward to seeing you then, and we'll get you a written format posted on Friday. Enjoy the rest of your day today, and we'll catch up with you tomorrow. Take care.